Okay, for proper cleaning of the click line instruments, laparoscopic instruments, what you want to do is it disassembles into three parts. If I push this button and open the handle, that allows me to remove the handle, and you can soak that in enzymatic cleaner. The next part is to take the jaws of the instrument, rotate them clockwise or counterclockwise a quarter turn, pull out the centerpiece, the insert, and this also can soak in the enzymatic cleaner. And you want to just let it sit in there for about 10 minutes to get rid of any organic matter. Real important place to work on to try and clean is the hinges of the jaws, and the enzymatic cleaner does an excellent job of getting into those hinges. But I would also take a brush to this. We sell cleaning brushes, or a soft bristle toothbrush could also work pretty well. Lastly, you want to take the flush valve of the insertion tube. You can hook up a syringe with the enzymatic cleaner in there and flush enzymatic cleaner into the tube to get out any organic matter. There's a brush that runs down the distal end of the tube, and it'll come out all the way to the proximal end. And once you get rid of that organic matter, then I would flush once again with distilled water or clean tap water. Let it dry. I sometimes shake it to dry it out, and then you want to close the valve again so that's not in the way of the doctor when they're about to do a procedure. Technically, you're supposed to sterilize these three pieces separately, and then it would be up to the doctor to, again, put the insert inside the insertion tube. You slide it in. Make sure you lock it on. Once it's locked on, by turning a quarter turn clockwise, you shouldn't be able to pull the jaws back out. If you don't lock it, it won't connect properly to the handle. So you turn quarter turn, it's locked on. Hold the bottom handle, slide it onto the forceps, squeeze, and now it's connected and working properly. Oh, go ahead. Okay, to properly clean the telescope, the operating telescope, I always like to say first, what I say here does not supersede what's said in the manual, so please refer to the owner's manual. But you have this valve here that keeps the gas from coming out of the scope. So you want to unscrew this with the silver ring and take the valve off. Then with this valve, you can take off this white sealing cap. You want to make sure that's nice and clean inside. Then unscrew the black cap to expose the silicone leaflet valve. Take out the silicone leaflet valve, make sure that's clean. All of this can be soaked in enzymatic cleaner, including the scope. And then make sure the barrel of this is clean. There is a cleaning brush that you can run down through the channel of the operating scope to drive out any organic matter. And then in the end, you also want to hook up a syringe and flush the enzymatic cleaner directly into the valve so that it can come out both this port here and that port and the tip of the scope, in order to make sure it's completely flushed out. Then usually what I will do is I will also hook up a syringe full of air just to blow out any excess moisture that might be inside the channel of the scope. The lenses you want to be careful with and only use a cotton tip applicator, both on the eyepiece as well as on the distal end of the scope, or you can use gauze, is also safe to use. Once the scope is cleaned, you want to dry it off with a soft cloth rather than just letting it air dry. And then you can reassemble the scope by putting the barrel valve back on here. Oops, excuse me. Where this nipple actually lines up with that groove. And then you put the silicone leaflet valve in next. The cap screws on, and then the sealing bonnet goes on last. And now it's nice and clean.